Good morning. Well, yesterday we saw the release of deaths of children in Queensland, and this report was tabled. What is devastating and tragic about this report is it's one of the highest numbers of children's deaths known to child safety in almost a decade. 69 children have died who have been known to child safety. This is almost a 30% increase. This figure is staggering and frankly unacceptable. We know from this report that the metrics changed in 2015, where we were capturing data of children known to child safety for a 3-year period, and that metric changed in 2015 to just an annual period. So the figures are skewed, and in fact, the numbers are much higher than we've ever seen before. The other report I wanted to draw the public's attention to is the progress report of the 2020 government election commitments by the Palaszczuk government that was tabled also the last few days, where Minister Linnard, Minister for Children, highlights, and I quote, "To ensure child protection system is as strong as it can be for the safety of vulnerable young Queenslanders." And it says completed. Well, when 69 children have died, one of the highest figures we have seen in this state, under this government's watch, I will not agree with the Minister that this figure is acceptable. I will not agree that this election commitment has been kept. And I certainly won't agree, along with many across our state, that it's completed. What it demonstrates, if the government think that the figures released and the reports that I have read in the last several days demonstrates their election commitment completed and that children are safer under their watch, they are sorely mistaken. And if they have no solutions, then they need to get out of the way and allow others to come forward with those solutions and get the work done. I also want to take this opportunity, after reading this report, to thank and acknowledge the child safety workers, day in, day out, who are working under enormous stress and a lack of resources. We know through questions on notice that the government have an issue when it comes to retaining staff, attracting staff, training staff to ensure they are the right people in the right jobs, and we're seeing a resource issue in the Child Safety Department, and that is just putting pressure on those officers that are out there trying to do their job. And we also know that their investigation timeframes are not even being met, that there are children at harm or at risk that are within over 1,000 days known to child safety and investigations not being completed. Once again, unacceptable. As we approach the Christmas period, when we know rates of domestic and family violence increase, when we know children are no longer at school, which at times is some of the safest place for them, I have very little confidence that we won't see this figure increase in the coming 12 months, and it is unacceptable. I'm happy to take any questions.
The mortality rate of children known to the child protection system is twice that of children. How do you address this?
What is staggering is that the mortality rate for Queensland children known to child safety is twice that of a normal child in Queensland. But what's even more staggering is the mortality rate of a child known to child safety from external factors is 4 times that of a child in Queensland. What that demonstrates is that there is an opportunity for intervention for that external harm or that external lethal factor to be eliminated. And that's not happening because investigation rates are not being met. The number of children known to child safety and the action or intervention that is required is not being undertaken. Foster families are already reporting, and have been for some time for the last 12 months, that reunification in some cases before a family is ready is also increasing risk of harm to children. And so those external factors are the preventable factors. And when a state government has all of the resources it has, when it has an integrated agency response, whether it be education, health, housing, community health and safety, Queensland Police Service, you have to ask the question, why has the rate increased? In the last 12 months, we've seen almost a 30% increase, and in the last decade, by changing metrics, the number has also increased. But they're just fudging the figures, in my view.
And so what do you think needs to change? What you see as the priorities and how to
Well, today I'm calling on the Minister, but more so the Premier, who has ultimate accountability as well, for every Queenslander, in particular vulnerable Queenslanders, to come out and take some accountability first and foremost and address what they are going to do. If they are going to reinforce their statement that that is completed, tick, we've done our job there, and deny the figures of what is harrowing, what is tragic, what is preventable, then I think the Minister needs to be held accountable, and it demonstrates that she does not have what it takes to lead that department and oversee the policy that needs to be enforced. I know the Attorney-General is standing up today. The Attorney-General was the former Child Safety Minister. I would hope she has something to say about this, given she oversees the report and the Child Death Review Board. And so we have 3 senior females in the Palaszczuk Labor government all saying, it's all good here, nothing to see, we've done a great job. We'll say that to the families of 69 children across our state who, for whatever reason, weren't capable of being able to care for their children. They were known to the state's care and they are no longer with us.
So what would be your solutions?
My solution at the moment is ensuring that a department is resourced. The figures, and that's just the first instance. When you look at the retention rates and the issues around workforce planning, this has not just happened overnight. This has not just happened because of COVID. This government has been in power for 8 years. 8 years. A department's workforce planning, when you are wanting to attract people to a department, when you are wanting to ensure that they are there to do the right thing by young children, and I've met many staff across this state, and they are there for the right reasons. But when they are not being provided the leadership, the cultural direction, the resourcing necessary to be able to do their job properly, or the training, then we see an issue around gaps, potentially system failures, and some of the other reports that have been released demonstrate that, simply in the amount of touch points that children known to the department have with various government departments. They're still operating in silos. There are ways and means in which those silos can be broken down to protect children. So right now, instead of the opposition putting forward solutions, which I will do every single day of the week, we first and foremost need a government that is actually going to accept accountability that their job is not completed. When they release a public statement saying, our job is completed, children are protected and safe, and 2 days later a report comes out that says, well no, if you're known to this state, in fact, you're 4 times more likely to die as a child. I don't think we should be accepting that. We should not be accepting that.
Cool, thank you everybody.
Thanks everyone.